Welcome to the Answers for Cancers podcast. Today we are going to be discussing the hormone therapy anastrozole. So we'll be covering what is anastrozole, how anastrozole works, about the side effects, and how anastrozole should be taken. This information in this podcast should be used in conjunction with the written information that's available within the app and any extra information that may have been given to you by your treating team. So to start with, can we talk about what is anastrozole?
Yep, so anastrozole is a hormonal therapy drug used to treat breast cancer. It's used if you have estrogen receptor positive or ER positive breast cancer. And it's used to reduce the risk of early breast cancer coming back, but it's also used to control breast cancer that has come back or spread to other parts of the body, also known as secondary breast cancer.
Brilliant. And do you mind just talking about how anastrozole works?
Yeah, so hormones are chemicals that our bodies make, and they act as messengers and help control how our cells and our organs work. So hormonal therapy drugs such as anastrozole change the way hormones are made or how they work in the body. So like we said, many breast cancers rely on the hormone estrogen to grow, and this is called estrogen receptor or ER positive breast cancer. So anastrozole blocks an enzyme, which is a type of protein that helps produce estrogen in the fatty tissues of the body, and this then reduces the amount of estrogen in the body.
Brilliant. And we might just touch on some of the side effects, starting with hot flushes.
Yeah, so hot flushes and sweats are a really common side effect of this treatment and any hormonal therapy. During a flush, your neck or your face may feel very warm or look red. Flushes can last anywhere from a few seconds up to 10 minutes. So you can have sweats and then feel really cold and clammy as well. And some people report feeling very anxious or irritable during a hot flush as well. So you may have fewer hot flushes or sweats as your body adjusts to hormonal treatment. However, if you don't, and this is impacting your day-to-day living, your doctor can prescribe medications that can help with hot flushes in certain circumstances. And hot flushes and sweats usually stop after a few months of treatment finishing, but for some people they can continue. So there is a couple of practical tips and tricks you can do to try and help reduce flushes. Such as wearing clothes made from natural fibres such as cotton, wearing layers of clothes that you can remove when you feel hot. Using cotton bed sheets can also help, or have layering on your bed that you can remove if you feel hot during the night. Keeping room temperatures cool, or use a fan when necessary. And having cold drinks over hot ones if you can, and avoiding drinks with a lot of caffeine in them where possible.
That's brilliant. And I suppose some other side effects that people may experience can be like tiredness. Do you mind touching on a few more for us?
Yeah, perfect. So tiredness is another common side effect. So what we would say is to just try and pace yourself and plan your day so you have time to rest. But regular exercises or getting out in fresh air for short walks can actually help give you more energy. But we would say if you do feel very sleepy or tired in any given day, to not drive or operate any machinery. And the Answers for Cancers podcast actually have a really good episode on managing fatigue with Dr. Deirdre Connolly, where she goes into managing fatigue in a lot more detail. So you can refer to that if you do feel like you need more information. I suppose moving on from tiredness, something else that can be a common side effect of this treatment is muscle and joint pain. So you can get pain within the muscles and the joints, and if this is something that is quite significant, do tell your treating team, as they may be able to give you painkillers where necessary. Practical things like remaining physically active can help with the pain and keeps your joints flexible, along with maintaining a healthy weight as well. Another side effect that can be common with this type of treatment is bone thinning, also known as osteoporosis. So this can happen after several months of taking this treatment, and having osteoporosis or bone thinning can increase your risk of a broken bone or fracture. So you may have a bone density scan to check your bone health before or during your treatment. However, this is at the discretion of your treating doctor. Doing regular exercise again, such as walking or strength training, can help improve your bone health, along with eating a healthy diet as well. Your doctor may prescribe drugs called biphosphonates that can help protect your bones. However, this is only in certain circumstances, and it is based on the results of a bone density scan. And again, it's at the discretion of the treating doctor, and they're not prescribed for everybody. And they may also advise you to take calcium or vitamin D supplements while you're on this treatment. However, again, we do not recommend people to start taking supplements without having a discussion with their treating team. Moving on from that, mood changes or depression can be a common side effect of this treatment. So if your mood is low or you think you may be depressed, we strongly recommend that you talk to your cancer doctor, your breast care nurse, or your GP. It is very normal to have feelings of low mood after a cancer diagnosis, so it can be quite difficult to differentiate between this and low mood that's associated with hormonal changes. So the most important thing to remember is just to not struggle alone or in silence. Do communicate the changes in your mood to your treatment team, and just to ensure that you receive the best support and care possible. Your doctor and nurse can refer you for counselling or talk to you about medications that might help if required. Feeling sick or having indigestion or tummy pain can be something that's associated with taking this treatment. However, any sickness is usually very mild, but you do need to let your doctor or nurse know if it's happening. You can try take anastrozole with food or at night time to help this, but if it doesn't help, you can speak to your nurse or doctor and they can look at giving you some medications to help control nausea. Other things that can happen when taking this treatment are that the cholesterol levels in your blood can be elevated, and cholesterol is a fatty substance that's found in your blood. So your treating doctor will organise blood tests to check your cholesterol. How regular this is at the discretion of your treating doctor. The medication can also have effects on how your liver functions. However, this is usually very mild, and again, this will be indicated by a blood test that you'll have that is arranged by your treating doctor to check how well your liver is working. So moving on from that, when you're on this treatment, you can experience changes in your appetite or loss of taste. So if you don't feel like eating 3 big meals a day, what we would say is to try eat smaller, more frequent meals or snacks instead, because it's really important to ensure that your calorie intake remains at the level it should be. And also, there is access to dietitians within every major hospital in the country. So if you're struggling with your diet or to maintain your weight, do speak to your treating team as they can organise a consultation with a dietitian. You may also experience changes to your taste or have a bitter or metal taste in your mouth. So sometimes sucking on sugary-free sweets can help with this, and trying different foods can also help to find what's best for you, and this usually stops after the treatment is finished. Another common side effect can be hair thinning. However, it is usually quite mild on this treatment. But if it's a concern for you, it is something that needs to be reported to your treating team. And the Answers for Cancers podcast also has a really good podcast on alopecia that you can refer to if you would like some more tips and tricks on how to manage this if this is something that you are experiencing while on this treatment. Skin changes can also be something people experience while on this treatment. So your skin may become dry, itchy or flaky. So we would recommend using an unperfumed moisturising cream every day, and always tell your nurse or doctor about any skin changes such as rashes, as they may be able to give you advice and prescribe creams or medicines that can help. And any skin changes usually does improve when treatment finishes or when your body adapts to the hormone therapy. Following on from that, and more rarely, you can experience headaches or feeling dizzy. This is something that you should always speak to your team about, as they may be able to give you painkillers or assess it further and assess if there's a need for further investigations. And we would recommend, if you're feeling dizzy or have any headaches, that you do not operate any machinery or drive at that point in time. Another thing that's been reported by patients is weight gain. So you may gain weight while on this treatment. So again, it is recommended to remain physically active and eat a healthy diet. But again, this is something that you may need some help with during that time. So again, there is access to dietitians within hospitals, and also speak to your doctor or your nurse, as they may be able to refer you for some exercise programs that are available for people that are on any treatment. Something else that can happen while on hormonal therapy is changes to the vagina in terms of bleeding or dryness. So you may have bleeding when you start this treatment, or if you change to it from another treatment. So if bleeding does continue for more than a couple of days, you do need to report this immediately to your doctor or your nurse. In terms of vaginal dryness, you can use non-hormonal creams, gels or lubricants, and this can help with vaginal dryness or any discomfort you may be experiencing during sex. However, the most important thing to remember here is that it's non-hormonal creams, gels or lubricants. All of these products cannot contain any form of estrogen. So you do need to speak to your pharmacist or your doctor or your nurse to ensure that the ingredients in these creams are appropriate for you. Moving on from that, you can have issues with or experience side effects such as diarrhea or constipation. So in terms of diarrhea, this means passing more stools than is usual for you or having watery or loose stools. And if you do have a stoma, it'll mean it'll be more active than usual. So if you are experiencing diarrhea, we would say to drink at least 2 litres of fluids each day and to try and avoid alcohol or caffeine or milk products or foods that are high in fat or high in fibre at this time, and contact the hospital for further advice, as you may need some further support to help stop the diarrhea. In terms of constipation, so this means that you're not able to pass stools as often as you normally do, or else it might become difficult or painful. So some tips again are to just drink 2 litres of water every day and eat fibre-rich foods in this instance, such as fruits, vegetables and wholemeal bread. And also doing regular exercises can also help with constipation. However, if your constipation continues, you do need to contact the hospital for advice, and your doctor or nurse can give you some medications called laxative that can help if all the above tips and tricks haven't helped. Moving on from that, sometimes and in some rarer cases, the hormonal therapy can affect your nervous system, and this can present in pain or numbness or tingling in your hands and feet. So these symptoms can sometimes be caused by carpal tunnel syndrome, which is caused by a pressure in the nerve on the wrist. However, we are very aware that a lot of people on hormonal therapy have had previous anti-cancer treatments that can cause something called like peripheral neuropathy. So it can be hard to differentiate if this is old numbness or new numbness. And this is why it's really important to speak to your treating doctor or nurse so that they can help you assess this and monitor it. Moving on from that, there is always a possibility for anybody starting a new medication to have an allergic reaction. However, this is quite rare with hormonal therapy, but it can happen with any new medication. So signs of an allergic reaction include feeling hot or very flushed, having a skin rash, itching, shivering, feeling dizzy or a headache, or feeling suddenly breathless. So if you do feel unwell or have any of these signs or symptoms, you need to speak to a doctor or a nurse straight away, and do not take any more of the treatment until you have spoken with them. So some other important information to mention while on this treatment. So having a cancer diagnosis and being on any anti-cancer treatment can increase the risk of a blood clot. So symptoms of a blood clot can include throbbing pain, redness or swelling in your leg or arm, suddenly feeling breathless or coughing, or having a sharp pain which may be worse when you cough or take a deep breath. So if you have any of these symptoms, you need to contact the hospital straight away on the 24-hour contact number that you've been given. And if you can't get through to this line, you need to present to your nearest accident and emergency department. A blood clot is classed as serious, but it can be treated with drugs that thin the blood, such as that are called anticoagulants. And your nurse or doctor will give you more information on this if it's required. So some practical things that you can do to prevent a blood clot or to reduce the risk of developing a blood clot can be drinking plenty of fluids, especially water, and staying active during your treatment. But do remember that it's the cancer treatment and having a cancer diagnosis that causes a blood clot mainly. So it's never anybody's fault if they do develop a blood clot. These are just tips and tricks that you can do to reduce your risk. It's also important to mention that anastrozole does contain lactose. It is quite a small amount, but it is an ingredient of anastrozole. So if you have an allergy to lactose, do mention this to your nurse or doctor. In terms of contraception, anastrozole is usually used when somebody has gone through a natural menopause. However, if you have recently been through the menopause or are having treatment to stop your ovaries working, there is still a very small chance that you may become pregnant. So you do need to speak to your doctor or nurse about this. And if you are sexually active, it is important to not get pregnant while having this treatment, as the drug may harm the developing baby. And even if you have your menopause, your doctor and nurse will still recommend using effective contraception during this treatment. Also, just to touch off breastfeeding, you're not advised to breastfeed while you're having this treatment or for some time after the treatment finishes, as the drugs can be passed to the baby through the breast milk. And if this is something that is of significance for you, your doctor or nurse will be able to give you a little bit more information around this. And just finishing off, if you need to have any other medical treatment or dental treatment for any other reason other than your cancer, you should always communicate this to your treating doctor and nurse, and also to the other medical professionals or dental professionals that are planning to provide care for you, just to ensure that everybody is in the loop of your full care.
So thank you so much for walking us through those side effects that can be associated with anastrozole. If you wouldn't mind just finishing up telling us how you should take anastrozole.
Yep, so anastrozole is prescribed as a 1 milligram daily tablet, and it should be swallowed whole, and it can be taken with food or on an empty stomach with a glass of water. And like we said in the side effects, if nausea develops, anastrozole can be taken with food or at night time to help with this. It is important to mention that the starting dose of any drug can be adjusted by the prescribing clinician using their independent medical judgment, and to consider each patient's individual clinical circumstances. So just to finish off, and it's important to mention that everybody reacts to medications very differently, and if you're experiencing anything other than the side effects